Good morning, Professor. My name is Aarti, and I'm a student of Nursing Leadership and Management. Today, I'm here to discuss my academic writing on the assignment reflection video and paperwork on practice change using critical thinking. Critical thinking is the objective analysis and evaluation of a problem. So before making any judgment, one must think about all the possibilities and its consequences. Thinking critically means to ask questions to self-identify the key points and analyze all the information we have, and then applying the evidences, and in the last making the decision to solve the problem of the patient with creativity to improve patient outcome and satisfaction. So next is the personal practice change and clinical judgment. Here I want to share my experience. While working as a nurse in the hospital in ICU, I got patient who was on PCA pump to self-administer morphine. This was my first experience with PCA pump. I prepared myself mentally to deal with the patient. I went to talk to him, but he did not respond, and I thought that he was sleeping. After 10 minutes, I sensed that something was wrong, and I decided to assess the patient's level of consciousness, respiratory rate, and to examine the IV site. I was shocked. His respiration was just 8 breaths per minute, and he was difficult to arouse. I immediately reported the stopped the IV line and called the physician. It was morphine toxicity, and I administered naloxone as per the organization policies, and I monitored the patient response. I reflected critically on what I already knew, and I identified the problem. Patient was experiencing respiratory depression. Doctor instructed me to investigate the cause, and it was the proton pump malfunctioning, and I became very anxious and nervous after that, but I learned from this situation. So now whenever I get the patient with PCA pump, I will definitely check the functioning of the pump first. Then is the safe patient care and growth in clinical reasoning. In this, I will be sharing my understanding of the learning objectives as I learned throughout these weeks. I realized that critical thinking is an essential skill for nurses to develop, practice, and to provide quality patient-centered care. This knowledge helped me to develop my thinking, apply the concept to practice, and be able to question if my thinking is accurate. High quality safety care is dependent upon the nurse's ability to reason, think, and make judgment about care. Critical thinking is a broad term that encompasses the critical reasoning and judgment. Critical reasoning is a process in analyzing information that is relevant to the patient care, and when data is analyzed, clinical judgment about the care is made. So they are all interrelated. Further, I studied about the core competencies which are very important for a nurse, which I must develop. These are total 101 competencies organized thematically under 9 roles of like clinician, professional, communicator, collaborator, coordinator, leader, most important, advocate, educator, and the scholar. The model represents the multiple roles nurses assume when providing safe, competent, ethical, compassionate, and evidence-informed nursing care in practice setting. So I learned about the patient advocacy, which means like a standing or raising voice on behalf of the patient. So nurses being patient advocate, I can be patient representative, defend the rights and interests of my patient, contribute to decision making, and support the patient decisions. Advocacy is a moral responsibility of nurses and identified good communication skills and determinations to help patients solving their problems, as said by Danzizi, Aziatuel, and Aiken AD in 2017. Ethics, standard, and advocacy are interrelated. Nurses must overcome advocacy barriers to provide justice to their patients. Proactive nurse engagement in safety voice behavior is very essential. So to work as a RN in Ontario, we must be aware of the CNO codes, ethics and values. Types of ethical concerns for nurses are like resolving the ethical conflicts, document layout, client well-being, choice, privacy, confidentiality, respect for life, and maintaining commitments to the client oneself, nursing colleagues, other team members, and the last, quality practice setting. So these ethical framework is designed to provide nurses with the direction in identifying and resolving the ethical situations. The major function of nurse is to help the client in achieving health goals. So however, the conflict may inhibit the attainment of these goals. So to resolve the conflict, I learned, like, I must learn to provide client-centered care by following the client's lead about information giving and decision making as said by RNAO in 2003, by understanding the meaning behind client's behavior and using proactive communication strategies that focus fully on the client, the nurse client conflict can be resolved. So talking about the collegial conflict with the colleagues, positive collegial relationship results from good communication skill, mutual acceptance and understanding, use of persuasion rather than cohesion, and a balance of reason and emotion when working with others can prevent conflict with colleagues. So this was all about my assignment, and these are the references. I hope you like my work. Thank you, Professor.